Having a stroke is a dangerous, frightening experience. An emergency like this can happen anywhere, anytime, and to anyone. The minutes after the onset of a stroke are critical. Care begins with paramedics who work swiftly to identify a potential stroke and transport the patient to a qualified stroke center. Southwest Washington Medical Center is a pioneer in acute stroke intervention. We have the only comprehensive stroke center in Southwest Washington, staffed with experienced professionals who provide rapid stroke care 24 hours a day.
This is Barb. Barb is 60 years old. She had onset of right-sided weakness and slurred speech.
You squeeze my hands, Barb.
When she arrives, the emergency department physician assesses Barb's situation.
Can you try to lift your hands up for me? Does that work at all? It's okay if you can't, but try. Okay, this side's working pretty good, but the right side feels pretty weak.
Have you ever had this happen to you before?
The stroke neurologist is then brought in to determine a proper course of treatment.
Well, the initial concerns are, does the patient actually have an ischemic stroke? Are they having a stroke where an artery is plugged up and flow needs to be restored? Unfortunately, we have very few treatments for acute stroke, but of the ones that we do, the most important and useful is the administration of intravenous TPA.
Intravenous TPA, or Tissue Plasminogen Activator, is a clot-busting drug that can dramatically reduce long-term disability if administered within 3 hours of the onset of a stroke.
The longer that the brain is short on blood supply, the more damage that is done. So the sooner that the agent is administered and the more quickly blood flow is restored, the better the outcome.
Yeah, that miracle drug that they had did work a miracle here.
Maura Marcioni is living proof of TPA's powerful results. She received intravenous TPA at Southwest a short time after having a stroke. Her husband Ron was by her side and witnessed TPA's dramatic effect.
When they gave her that shot, that's when nice things started to happen. And 8 hours later, roughly, they brought her up to the ICU. And at that time, I felt she was pretty well back to normal.
And I just seemed to recoup so well. It was a close call. And I'm just glad that everything was there and the medicine. I had never heard of this before.
Southwest can also administer TPA to many stroke patients that are admitted outside of the 3-hour window. In these cases, the patient is sent to the angiocath lab, where a neurosurgeon administers TPA directly into the clot.
In patients who are outside of that window, we can often thread a microcatheter all the way up into their brain and infuse this clot-dissolving medicine directly into the blood clot to reopen the artery.
If it's not safe to administer TPA, the neurosurgeon can thread a corkscrew-like device called the Mercy retrieval system into the patient's affected artery and physically pull the clot out. The Mercy retrieval system consists of the Mercy retriever, the Mercy balloon guide, and the Mercy microcatheter. The procedure is minimally invasive and very effective at restoring blood flow.
It's tremendously rewarding to go in, take a life or death problem and just fix it. I mean, when you're able to reopen an artery like that and take someone from a problem which will probably kill them or permanently disable them and let them make an excellent recovery, it feels fantastic.
Okay, give yourself a little bit more space between your feet.
Therapy is vitally important to a stroke patient's recovery. Southwest has an on-site, certified inpatient stroke rehabilitation unit. Stroke patients undergo physical, occupational, and speech therapy to help aid in their recovery.
The rehabilitation phase of recovery following a stroke starts almost immediately, and during that phase of the program we're trying to maximize somebody's recovery, making sure there are as minimal physical and medical problems occurring as possible, and then trying to get them home or back to the community. So are you keeping up with the other focus that we have here has to do with making sure patients don't come back to see us again. And the reason that's critical is we spend a lot of time trying to educate patients and families about what they have to do to lead a healthier lifestyle and to do the things that will minimize their chances of having another stroke. I think that's a key component of our stroke program in general.
Thanks to TPA and the stroke team at Southwest, Maura Marcioni has been given a new lease on life.
Now, I'm paying more attention to things. I really felt that I was healthy. And I think that's why so many of the people that know me were so shocked to hear that I'd had a stroke. You know, they would see me walking everywhere, and they would laugh and they'd say, well, you know, we get in our car, but Maura can walk as fast as the car. And, you know, and so I just, it was a shock to them, and it was a shock to me.
To learn more about stroke and whether you might be at risk, call the Stroke Center at 360-514-3273 or log on to our website. Southwest Washington Medical Center, pioneering medicine for 150 years and counting.